Hi, thank you for being here with us today, Arizona Metro News. My name is Coreen Zalot, and I am your host today. We're going to be talking with Penny Wittbrodt, registered nurse, who has recently recovered from COVID-19. Penny will be sharing her expertise and how she has managed to recover from COVID. Please remember that this is not intended to be medical advice. You must always seek the advice of your healthcare provider. Without further ado, welcome Penny Wittbrodt to the show. Hi, Penny.
Hi, Coreen.
So we are doing part 3, but we are going to circle back and talk a little bit more about where we ended last time. We were getting into the inflammatory response and the vasculitis. One of the things that I found in my research as well was the cytokine storm issue. So do you want to tell our viewers what cytokine storm is and how that impacts the body with COVID?
Yeah, definitely. I kind of want to put out there that this is probably the first time that anybody's ever heard that cytokine storm, unless you're in the medical background. But cytokine storm can happen with any viral illness, bacterial illness. We see it in patients that have burns, different things like that. So we've always known that the body does this. So it's not something new with COVID that everybody needs to be very scared of, because we've seen it and we do know how to treat it, actually. But what happens is when the virus enters your lungs, so the virus isn't alive, it can't crawl into you. So, you touching your face, it can't then crawl down into your lungs. It's just not how it works, because the virus isn't alive. It needs to be in your body before it can do anything. And so when you breathe this in and this virus gets in there in your lungs, your body makes an inflammatory cytokine. And it's important because what it does is it's kind of a signaler to the rest of the immune system. Hey, something's in here that's not supposed to be in here. And all these other white blood cells and different sorts of things come to help get rid of that. And what happens with COVID-19 in some patients who already have a lot of inflammation because they have diabetes or whatever, their inflammatory markers are already up. Their CRP, which is C-reactive protein, is already high because they have blood pressure, diabetes, all these sorts of things. And when it gets in their body, their cytokines that are inflammatory just keep coming. They don't stop. You have little things called dendritic cells, and dendritic cells are kind of the flag that tells everything to stop. And those get damaged early on with COVID if you don't treat patients early. And they can't tell the body to stop making those inflammatory cytokines. So they just keep going and keep going. And eventually they affect every system in the body.
Okay. So is there anything that somebody can do at home about curbing that cytokine storm? Or
it really is important that, I'm a little disappointed that they've not put out some just basic information for people. You need to know what your vitamin D level is, like what your age is. We're seeing that people who die from COVID-19 or end up in ICU or the hospital from COVID-19 generally have vitamin D levels under 40. 30 to 100 is normal. I kind of like 60 to 80, 50 to 80 for that sweet spot for immunity. And vitamin D3 is the way to do that. Some doctors will put you on vitamin D2, which is the weekly one, if your levels are very normal, and you're only supposed to do that for about a month until the levels come up, and then switch them to D3. And I see that doesn't happen a lot of times. And they'll still have, they'll go on for a while, and because D2 isn't well absorbed over the long haul, they'll be on a D supplement every week and their levels are still low.
Okay. And then
so
what
definitely a good D level.
Okay. And then what about vitamin C, vitamin K, vitamin A, NAC? I've been reading about NAC.
So D3, if you take it with K2, what K2 is it helps calcium get into the bones. And so that's why K2 is important with D3. And calcium is important because it regulates functions in the heart and the vessels. It's just a very important part of your regimen at home. And the other thing is magnesium. Magnesium is very relaxing to the blood vessels, and it calms down inflammation. In fact, in emergency rooms, they have treated people with IV magnesium to calm down asthma attacks and migraines, and it's actually very effective. And so having a good magnesium level is really important. And sometimes your D won't come up until your magnesium level is good. So there's that. What were the other ones? Vitamin C. So you'll see all kinds of conflicting information about vitamin D. So I'll just tell you what I know from my practice. When we had patients, C, I'm sorry, C. So from my practice, when patients had sepsis, vitamin C was in that protocol. You could give high dose IV vitamin C because what it does is it reduces inflammation. It also gets on the platelets, so the part of the red blood cell. So it gets on the platelet and it makes them less sticky, so you're less likely to clot. And it's really good information. There's some good studies out there about two different types of vitamin C, ascorbic acid and sodium ascorbate, and they just kind of they peak at different times, but still a good vitamin C level is a good thing, and it's hard to check. So just daily vitamin C is good, and I take it morning and night, so I have a consistent level. And if I go out, I take it before I go out and when I get home as well, just to kind of cover me because I've been out. Zinc as well.
Oh, I'm sorry. I didn't mean to interrupt you. I'm sorry. There's two things that I just want to point out. There's considerations for IV vitamin C. There is a blood test that needs to be done to make sure that you don't have
G6PD deficiency.
Yeah, because that can cause other health issues. And then with vitamin K, you also have to be careful for clotting disorders. If you have a history of clotting disorders.
Or you're on blood thinners.
Okay. All right. Sorry.
And then zinc. Don't forget zinc. Zinc is really important because zinc is great for immunity. And the one thing you can do, since a lot of people probably aren't going to be able to get hydroxychloroquine, which is insane, I did want to tell you, in 2017, DoseCalc did a study of the top 200 prescribed drugs, and hydroxychloroquine, Plaquenil, same drug, came in at number 128. There were 5,666,999 prescriptions written for hydroxychloroquine, and there was no media outrage. There were no politicians limiting the prescription of it. As far as I know, there were no mass graves. It has a very good safety profile, and I also see the news using chloroquine and hydroxychloroquine interchangeably as though they're the same drug, and they're not. Hydroxychloroquine has a much better safety profile, but assuming you're not going to be able to get either one, quercetin also has some of the same actions as hydroxychloroquine. So hydroxychloroquine kind of changes the pH in the cell, and that makes it a little like where the virus just doesn't want to be in there as much. And if you take it with zinc, it's a zinc ionophore, so it allows zinc to come into the cell. And zinc is damaging to viral RNA, the viral genetic code that's in the cell. And if you can damage that genetic code early on, you can stop it from making copies of itself.
Okay. And then I've heard reports too of the quercetin being in tonic water. So some people are going out and purchasing large quantities of tonic water to.
There's quinine in tonic water, not quercetin.
Okay. Sorry. I was getting
That's okay. But it's kind of, you're thinking along the same line, because quinine is what we derive hydroxychloroquine and chloroquine from.
Okay.
And so I don't think there's probably enough in tonic water to do you any good. I don't think it's going to hurt you, though.
Yeah. I mean, you'd be well hydrated, but yeah. So we were talking sort of off screen too about the whole sort of politicized everything that's going on around the hydroxychloroquine and how, all of this has been politicized. You had mentioned that, you couldn't get the hydroxychloroquine, the higher dosage, unless it was for vasculitis. And you were mentioning that you were thinking that maybe that would be a new protocol, would be to do it, for vasculitis. Do you want to talk more about that?
I do. So I've been, never in history have I seen, at least not in my 50 years on Earth, I've never seen a program to stop doctors from treating symptoms of a disease, whether we knew what the disease was or not. If you had a disease that caused blood clotting, we didn't need to have a study showing that anticoagulants worked for that disease, because we already knew it worked for blood clotting. If you've got inflammation, we have drugs to treat that we've used for other diseases. And I will agree that hydroxychloroquine combined with azithromycin can be very dangerous for somebody who's in ICU, who already has just a ton of damage to their body. Their kidneys are damaged, their liver is damaged. My question would be, why are we waiting that long to treat people? Why are we telling people not to come to the hospital until they look blue or they can't breathe, and then giving them a ventilator treatment that we know to be 80 to 88% lethal, or an antiviral at that point when you're already out of the viral stage? And the nice thing about hydroxychloroquine is it's helpful for vasculitis. It's a good, even there are NIH studies that talk about hydroxychloroquine for vasculitis, and that's one of the things that kills people with COVID. And so you could actually prescribe hydroxychloroquine for vasculitis and probably get that patient treated early on, and avoid all of the stuff later, because there is no off-label rule against providing a patient with hydroxychloroquine for vasculitis if you feel that's what they have. So if they have a high CRP, a high inflammatory rate, and other symptoms of vasculitis that you see with COVID, that's something to consider.
Right. Yeah. I mean, I think it kind of goes back to, this is just clearly so politicized. And it's, I mean, we'll get more into sort of the controversial aspects of that, and who's kind of benefiting from all of that. Because it does blow my mind that and who's dying from it, and also it just blows my mind that a medical doctor can't use his clinical judgment to treat what he's seeing, what's presenting. And it's got to be filtered through WHO and CDC before it's authorized. And, they're the ones that establish the protocol, which just blows my mind. But we'll get more into that into the next segment. Our time is already up. It goes by so fast.
It does.
But I want to thank you so much again for being here with us on the show. And for the viewers, please like us on Facebook and YouTube, and follow, like, share. And Penny, we will be picking back up again in the next segment. For everybody who's watching, thank you so much for being part of the show. Thank you, everyone.